we are able to meet the needs of patients not only within this community but in our surrounding areas as well. That service started a year ago. We've done over 400 transfers between facilities, and we're very proud of that. And then the most recent project has been the opening of the urgent care back in October of last year.
Yeah, we're going to talk about that in a few minutes. Daymeyun's going to be in the hot seat in just a few minutes. Give him a minute to cool off, and it's not very cool in here, let me tell you. It is sweltering, I think, is the word that comes to my mind. And look, we're all smiling. That's a good thing, right? So you don't have to hold patients too much in the ER. And I do want to highlight your physician group. I think they're great. You know, I worked there, and I've seen the good, the bad, and the ugly, so to speak, although there was never any ugly and never any really bad. But this particular group, they've been there for several years.
They have, I believe, since around 2018, 2019.
And I think they do a fabulous job.
Yes, Wake Emergency Physicians and PAs is our provider group. They serve both the emergency department and the urgent care as well. And I use the word partnership a lot when we talk about things, the partnership with UNC. The partnership with WEPA has also been one that we've really enjoyed. They are true colleagues and peers. We enjoy their level of engagement and enthusiasm. They serve several other hospital emergency departments within the UNC system as well, and I think that's just a demonstration of that level of commitment that they have. So we're very pleased, and most of them are local and permanent NASH providers. So when you would come in, you would recognize those providers as folks that are stable and permanent to the setting, and that's important.
I've noticed that in my ER records, and you know, even admission that they were admitted through the ER and they saw Dr. X before Dr. Y took over, and I've never had a problem as a nurse practitioner calling and saying, I've got such and such patient, he's an AFib, his heart rate's 170, and they're always gracious and just ready to, they ask pertinent questions and ready to accept the patient. So it's nice from the, we're the outside looking in, and I understand the hospital system and I understand the ER system because I worked it, but a lot of providers don't, and their pat answer is go to the ER. No, that is not the answer, and so we're going to talk about that in just a minute too. So Daymeyun,
yes,
you've been recruited. Is that correct? Tell me how we got blessed to have you in our system.
So you got blessed to have me in my system because I'm actually new to the area, so I've been here since 2023. My wife's family, they're from Wilson, North Carolina.
Oh, okay.
So I'm originally from Charlotte, North Carolina, where I've worked with Atrium Health and Wake Forest Baptist Health, which is in Winston-Salem, North Carolina. So I've worked in clinic registration, clinic supervising, managing type of thing, and then my most recent role before this one was patient experience with NASH, and then now I'm the manager of the urgent care.
Awesome.
Yes, ma'am.
Awesome. That's great. So you were born and raised in Charlotte?
Yes,
is
ma'am.
that right?
Charlotte, North Carolina.
Okay. Where'd you go to college?
I went to college at Winston-Salem State University, where I received my bachelor's in healthcare administration, and then just recently last year I actually attended Wesleyan and I got my master's.
Yeah.
Yes, ma'am.
I think that's awesome that you came here and finished and pursued. And
yes, ma'am.
I've got a master's degree. I know how hard that is.
It is. I actually
you crank out a paper a week.
Yeah, it's crazy. I actually started at Pfeiffer University in Charlotte, where I attempted the first go round with my master's. Didn't really work out because, like you said, it's really intense. So then I was able to pick it back up once I moved here to this area.
And sometimes it's just, it has to be the right time.
Absolutely.
Sometimes things are happening in family or things are happening at work and you just can't put the time you need to.
Absolutely.
And I worked full time through all my degrees, so
Me too.
that's a challenge in itself, isn't it? Yeah.
Yes, it is.
Yeah.
It is.
Yeah.
Yes, ma'am.
Daymeyun is just so humble. He won't tell you the real story.
Okay,
but
tell us the real story,
When
Meredith.
he came to NASH, he applied for a position in the patient experience department, and I was fortunate enough to sit in on that interview because we really needed someone in the emergency department to help bridge the gap sometimes between the clinical staff and the patients, to help them understand, to be that liaison liaison between the clinical environment and what the patients were needing, that communication. Very quickly, Daymeyun acclimated to the environment. He became a beloved member of our team. Patients loved him, and he has a gift, and communication is his gift. And so I really was so impressed by him that when the urgent care opportunity came for me to manage the project, I couldn't think of a better person to be able to manage an area that way, as well as his background with the clinic environment, the outpatient environment. And so we were just really happy that he joined our team and that he was able to show that skill set, because he's truly an asset to our team.
Thank you. I
Yeah,
appreciate
it's true. He didn't pay me anything extra.
So what exactly did you do when you were in that role in the emergency room? I mean, how did you, what were some of your responsibilities? You had to calm down some patients that may be a little upset with the wait or whatever?
Yeah, the wait, maybe the service that they were receiving from their nurses, or if communication wasn't there with a provider. So every day was something different, and I feel like that's why I loved it so much. I was able to step in and make an impact, and I was also like kind of that voice for them. So that's why I enjoyed the position so much.
Patients just want to be heard.
They want to just be heard.
And nurses and doctors want to hear, but they've got
17 other patients going on.
And
so.
they've got so many other, they're thinking about the guy in trauma 1 who, is bleeding out, or they're thinking about, it's hard to concentrate on one
Absolutely.
patient when you said like they've got 17 other ones.
Right. So just going out there every day, whether it's in the actual room or the waiting room or wherever I was needed that day, just gave me a sense of satisfaction that I was helping them, going that extra mile, just giving them that information. Hey, Dr. Such and Such, they're putting in an order. We're just waiting for you to go upstairs. We're waiting for you to be triaged. Different things like that.
And
so.
those little snippets of communication are so.
Makes you feel so much better as a patient.
You just want to know what's going on.
Exactly.
Instead of looking at your watch saying, with my bruise right there, saying, I've been here 2 hours and 10 minutes. Where is that nurse? Why are they're not doing nothing?
And we learned so much. Absence makes the heart grow fonder, I suppose. But we've learned so much from Daymeyun's time in the emergency department about exactly what you said. That missing communication many times can make such a difference.
Absolutely.
And so our goal now is to enhance that communication, to regularly let patients know why they're waiting, what the next step is. Those are really the things that we're focused on now, especially as we prepare to unveil this new area of the department that we're going to be staffing and working with our patients while they're waiting for those results.
So you still have somebody that's in Daymeyun's old role since he's...
We have several different resources that we're utilizing, but there's no replacing Daymeyun.
No replacing.
It's not possible.
And I just wanted to add too, once being that my main domain was in the emergency department, and say like a patient was going to get admitted, I would then follow up with the patient once they got to the 4th or the 5th floor of the heart center, wherever they were going. Just to make sure that they're still being well taken care of, making sure the doctors are staying on top of everything. And, just
great.
Trying to bridge the gap wherever I could.
Yeah. And it's nice for somebody to follow through all the way through, because people are scared.
Yeah.
I mean, I can say, oh, you're going to have a heart cath. It's not a big deal. Well, maybe it isn't to me.
Exactly.
But I'm not laying in that bed, and I'm not the one that has to have somebody do all those things to me,
Exactly.
I
And
think
people don't understand.
You're exactly right. I think what we also learned from the pandemic, especially during the time when we weren't allowing folks to have visitors, is the value of healthcare advocacy, the value that the lay caregiver provides us. Daymeyun has served in that role, and even in my own, personal space, with family members, it is important for us to recognize the value of healthcare advocacy. And if individuals don't have family that can serve that role for them, folks like Daymeyun, who are still working in the hospital today, can serve in that role.
That's right.
So there's just no substitute for it, because frankly, it is a busy place. There's a lot of unknown, and it can be very isolating when you don't feel like you have someone to sort of translate those things for you.
Yeah, and it can be a bit chaotic in
Absolutely.
that ER. So, you can help calm that too, because it's just can be a really scary experience for everything.
Okay.
So, it's just, I think it's awesome. I wish we would have had that when I was there, but
Yeah.
glad you got it now.
Yes,
You know,
absolutely.
we're always working on improving, right? We're always making it better. That's
Always.
awesome. That's awesome. All right, we're going to take our first break, and when we come back, we're going to talk about when you go to the ER and when you go to urgent care. How do we make that decision? Which road do we go down? So don't go away. We'll be right back. Hang on.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't arise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
When Jay arrived at the emergency department with a hernia, he was in pain, scared, and unsure of what would happen next. That's when he met Dr. Clarice Monnier.
The way she conveyed, it was something that I could understand. She didn't talk over my head. She called me at home on her cell phone just to see how I was doing. They really treated me like family. I just can't say enough. I wouldn't be hesitant to come back here.
Learn more at nashsurgery.com.
Hello, welcome back. This is Here's to Your Good Health. My name is Linda Prezioso. I've got Meredith Denton, who's the manager of the emergency room at UNC Nash, and we've got Daymeyun Johnson.
That's correct.
Oh, I got it right. And he is the manager of UNC Nash, the urgent care. So we're going to talk. We're going to have Daymeyun highlight what's a real emergency. What can be handled at the urgent care versus the emergency room. We want you to absolutely have the best care you need. We want you to get the services you need, but we don't want to clog up the emergency room if urgent care can handle it. So tell us, Daymeyun, what are some of your diagnoses, so to speak, for, why do people go to urgent care?
People come to urgent care for various reasons. I just want to highlight a few of the most common things that we see, and then I can definitely, elaborate on each one of those and when it is appropriate to come to the urgent care facility or go to the emergency department. Excuse me. So we see a lot of individuals who have headaches, who are nauseous, who are feeling, ill related to their nausea. A lot of vomiting. Children who need like splints done and like minor wrist things. What is that? Wrist
Sprains
and stuff too. Knee pain, back pain. Just recently, we're gonna move forward with doing DOT physicals as well as sports physicals as well for children.
Oh, okay.
Yeah, so things of that nature. Elbow pain, back pain has been really, really big as of late too. And then we also do a lot of testing for like RSV, COVID, RSV, COVID, strep, Then we also have like some minor testing too, like BV and mono and all of that.
Okay, and can you run a urine there for a urinary tract
Yes,
infection?
Yes, ma'am. So we
Okay,
do that,
so
and
do
then
you,
pregnancy tests as well.
okay, do you have all that on site, or
Yes,
it has to be?
ma'am.
It doesn't have to be run over to the main hospital.
We have all
Okay.
that on site.
Uh-huh.
So, for example, like the RSV testing and the strep throat testing and all that takes about 10 to 12 minutes. We go ahead and get the patient swabbed. We pull them back, of course, get them swabbed. We go ahead and run the test, and then once the provider goes in, checks on them, does a quick examination, our CMAs, they then take that information that they get back from the Abbott machine, whether it's positive or negative, give that information to the provider, and the provider will go into the exam room and give that information to the patient.
What's about the average stay of a patient in the urgent care, would you say?
Yeah, again, it varies based on what they're being seen for, but I would say about 30 to 45 minutes.
Okay.
We try to get them in and out. I push to my staff urgency. It's an urgent care. We got to get them in and we have to get them out. We don't want them to stay there for that long and, take up their time because time is up there.
It takes me about that long and in the office setting, especially if you're running some tests like we'll do influenza or strep or something there too.
Yes, ma'am.
So
yeah.
COVID,
But as technology improves with testing and whatnot, I can see it being a little bit faster. Yeah. We've been having a lot of communication with our people who work in the lab, and they're saying like, oh, a new database is being built for this machine, so it's kind of going to speed up the process and get them in and get them out.
So, are there ever any instances where people go into the urgent care and then it's determined that they really do need emergency room care?
Yes, ma'am.
And so then how is that arranged?
So if the patient comes in and the provider kind of feels like either A, we don't have the necessary resources at our location to be able to see them there, then of course they'll go ahead and send them off to the emergency department. In other cases where it's a little bit more severe than that, like maybe the patient is bleeding uncontrollably or they are having some heart issues or some chest issues and chest pains and whatnot, we'll then call EMT, which is right around the corner from us. They'll come and get the patient.
They will.
And then they'll take them right around the corner to the emergency department.
Because you've got two kinds of people. You've got the ones that everything's an emergency and they're going to die tomorrow, and they always check with Dr. Google, of course. And Dr. Google says, well, you've got cancer. You've got that population. Then you've got the ones that kind of push it. Oh, it's just a headache. I've had it for 3 days, but it's really nothing. Or, yeah, I vomited several times, but I'm really, they kind of minimize everything.
Right.
So then your providers are going to have to kind of shuffle through some of that as well.
Right, and we have some very good providers at our office. We have actually 2 providers, and they kind of flip off 2 days on, 2 days on type of thing. And yeah, again, they've been in their profession for a very long time, so they're really good with determining whether or not this does need to be handled here, the urgent care, or if they need more additional testing or further.
So do you need an appointment to go to the urgent care?
Not necessarily. However, we do have that feature available online, so patients can go to. I like to give them these directions because it's just simpler. You can just literally go to Google, type in UNC Health Nash Urgent Care. Literally, the first link that pulls up will take them to the site so that they can go ahead and schedule an appointment. And it just locks in that slot, and we have 15-minute increments. So once that patient locks in that slot, they also have the option to pre-register. They give all their information, their insurance and stuff like that, submit it, then it'll fall into our queue in Epic or our DAR in Epic, and then it'll either say unconfirmed or confirmed, and the individual who works the front desk, they can go ahead and confirm the appointment for the patient. That way, by the time they come in, everything is done. It's literally just check in, verify that it is them, and then they're moving on through the process.
Right. And that's great for the younger ones and people that are computer savvy.
Absolutely.
But, we found out during COVID, we would see a lot of patients in our parking lot, and there was a sign that said, when you get here, call blah, 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 and then we would register them. Well, some folks didn't even have cell phones, and so, some of the older population, me included, we're not as computer savvy and things. Some of that's a little bit hard. So they do have the option just to walk in as well. Is that correct?
Yeah, and I think, Linda, with that whole aspect of COVID and the way we were doing things back then, some of our patients also have still, they kind of adopt that within 2025. So a patient may come in and they are, feeling ill and whatnot, and they don't want to spread their germs, even if they do have on a mask. So they'll tell us, hey, when you all are ready to be seen, well, I'm ready to be seen, can you just give me a phone call? So yeah, we definitely accommodate that.
Yeah, that's great. Yeah, it's better for them. It's better for the rest of the people that are in there
Absolutely.
as well.
Absolutely.
So it just makes a big difference. And what are your hours there at the urgent care?
Our hours currently are from 8 to 6. However, we're still moving forward with doing 9 to 7 so that we can better help serve the community. Because, a lot of patients or a lot of parents of children, they get off a little bit
Sure.
later at 5
Yeah,
o'clock.
yeah,
So we
sure.
definitely want to be there for them.
That's
That
great.
child might have an earache and mom couldn't get the kid there until she got off work. So
Right.
That'll
definitely
start
wanna
on
do
June 1st. Our hours will shift to 9 to 7. So we're
Okay.
excited about that and being able to be available just a little bit later so that the emergency department isn't the only option for
Right.
those folks that have the appropriate type of urgent
That's
care
right.
complaints.
That's right. That's right. And there's several urgent cares now, but I think there's probably plenty of room and plenty of patients for everybody.
Absolutely,
I don't
absolutely.
think any of us have to fight for a patient, right?
No, definitely. Yeah, and I'm actually glad that we are moving towards doing that 9 to 7 time frame because we've noticed as we're getting close to taking that last patient of the day, some of those parents or some of those individuals who couldn't get off work in time to come are, pulling at the door and, so just making sure that we're there for them, making sure
Yeah,
that we're there
I
for,
think that's
for the
great.
community. Yeah.
That's great. And like now, look, there's a lot of ball going on, soccer and softball and baseball and that
Absolutely.
kind of thing. So do you have x-ray availability?
Yes,
You
ma'am.
do.
We
So if somebody gets hit by a ball in their forearm or their humerus,
Yes,
then
ma'am.
you can x-ray that and then
Absolutely.
I was going to say your ER doc, your doc can determine,
Yes, ma'am. They
if it,
can. Yeah.
and so if the arm, let's say it's broken, but it's it's a clean fracture and everything. So can you set that and make a referral to orthopedics? You do all that.
Yes, ma'am. We do all of that in-house. Yes, ma'am.
Okay.
Monday was a really busy day. I don't know if everybody was just out and about having fun all weekend, but we did about 6 x-rays. 2 of our patients, they actually fell down a hill, which is crazy. So we were absolutely able to help accommodate them. And then our provider for that day, she was able to go in, get the patient situated, put a boot on them, and then she sent them out the door, but she also sent them with a referral so that orthopedic could follow up with them.
Great.
Yeah, we do all of that in-house.
Okay.
Yes, ma'am.
All right. So that's great.
We're also excited to be growing urgent care services in the surrounding areas as well, and so looking at expanding urgent care into other areas in the Nashville area and in the Middlesex area. So
I think I saw a sign in Nashville
yes,
about that.
Yes. Next summer is going to be a busy summer for us, but we're very excited about, again, just extending our reach to provide access. And not only will that building serve as urgent care, but also primary care. And so,
Really?
yes,
Both of those?
Yes.
No.
Yeah. So we're very excited about that. And again, just enhancing the access for healthcare in the region.
Yeah, that's great because, Nashville, they do have a primary and urgent care now with Dr. Emmanuel, but that's not enough either. And Nashville's really starting to bloom and prosper and grow a lot. So that's awesome. I'm glad to hear that.
Yeah, I'm excited as well.
Yeah, and I think you probably are extending like to Middlesex and those areas farther out as well.
Yes.
That's
Yeah.
good because it's nice. I mean, I live in Red Oak. There's nothing in Red Oak.
Yes.
I got 2 stoplights and a Dollar General.
Yeah.
So and it's as far for me to drive to Nashville as it is for me to go to Rocky Mount. So and it's good that they're extending and
Yes.
expanding. That's awesome.
Yes, it makes it easier. Yeah.
Our urgent care is also open 7 days a week, and so
Oh, okay.
there are some that are only open, 5 days a week.
That's right.
Have limited hours on Saturdays and
uh-huh.
Sundays, and we have consistent operating hours 7 days a week. We have only closed on the 3 major holidays, Thanksgiving, Christmas, and New Year's, because again, we certainly want to be there during those times when
Sure.
our patients may need us most.
Yeah,
and
that's right.
holidays
All the-
they don't stop
No,
for
they
emergencies. emergencies
They sure
or minor
don't.
emergencies.
That's right.
So,
That's right. Oh, that's great. That's good to know.
Yeah.
Just 3 days a year. That's awesome. So I had a question that went in and out of my brain. Oh, DOT physicals, is that something you're going to be contracting with companies, or like if I need a DOT physical, can I just come over there and do that? Or, how is that working? Have you started that yet?
Yeah, we've started it, but we are about to really start advertising it a little bit more so that we can get that traffic coming in. Yeah, so we do DOT physicals. You can literally just walk in, and our providers are well equipped to go ahead and do that. Our CMAs also kind of get the ball rolling, and then the provider comes in on the end and does what she needs to do.
Right,
Yes,
right.
ma'am.
Okay.
we're also excited, though, to enhance those services with potentially working with specific employers to provide for their
Sure,
occupational
of
medicine
course.
needs as well.
Yep.
Yep, more to
So,
come on that.
Okay, so you're going to be expanding your occupational medicine then too?
Yes.
Always expanding, always improving, always growing. That's the
Yes.
name of the game.
Yes, ma'am.
And what about like drug screens? That I guess, I guess ordinary folks don't need a drug
Yeah,
screen.
currently we haven't done those. We do have the capability of doing those, and again, part of the expansion into more occupational medicine. Once we do that,
Will be
we would
that
be
as
more
well.
equipped to do that. Yes. Yeah.
And so you're going to be doing like pre-employment physicals?
That would be our goal. Yes.
To do all that as well?
Yes.
Okay, perfect.
ma'am.
Sounds good. All right, Meredith, you're up. Tell me when to go to the urgent care and when I go to see you.
Well, as I mentioned before, maybe before we went on the air, we see patients greater than the age of 6 months. So for us, babies, infants under the age of 6 months, if they've got an emergency that can't go to the pediatrician, they'd need to come to the emergency department and skip the urgent care. Many times, infants have a little bit more complexities and need just a little bit higher level of care than what an urgent care may provide. So we would encourage folks with babies under the age of 6 months to bypass urgent care and come visit us in the ED. But other common illnesses that folks should probably consider coming straight to the emergency department: signs of a heart attack. So chest pain, especially if you're over the age of 30 to 35 years of age. Any pain that kind of starts from the neck down to the pelvis may need to consider coming to the emergency department for that. We know that signs of a heart attack can present differently in men and women, and so shortness of breath. Pain that radiates into the jaw or down one arm. For women, pain that radiates into the back or sudden onset of fatigue associated with that pain. Those are all signs of some sort of cardiovascular event, and we would encourage folks to go to an emergency department setting for that.
Right.
Signs of a stroke.
Yep.
So facial drooping, weakness on one side or another, difficulty with balance, difficulty with speech, slurred speech. Those are things that 911 needs to be called for, not wait.
Right.
Severe shortness of breath. We are able to accommodate some folks with a breathing treatment, and if after one breathing treatment they clear up, we can certainly go ahead and discharge. But folks that are having severe shortness of breath and difficulty breathing need to bypass the urgent care. Sudden loss of vision in one eye is not something that the urgent care is going to be able to necessarily manage. That's more of an ocular or an eye emergency. So those are things that would need to come straight to the emergency department. Bleeding that is uncontrolled, that is not able to be controlled, needs to come straight to the emergency department as well. We are able to manage minor lacerations in urgent care, but amputations of digits or limbs, things like that are not really able to be managed. Broken bones, where the bone has protruded, that would be something that would need to come to the emergency department. Older patients, maybe patients in greater than the age of 65 with abdominal pain, can certainly be a sign of something a little bit more severe than just your routine gastrointestinal disease. And so that would need to be something that is seen in an emergency department setting. So those are just some a few examples of things
Right,
that we would
right,
encourage folks to
right.
bypass urgent care. We're always happy to see folks in the urgent care, and we'll try to disposition out if they need to come to the emergency
Sure.
department, but we certainly don't want to delay care for a true emergency by
Right,
doing that.
right.
And again, our emergency department never closes. We're
That's right,
open day and night.
24/7,
and we're
365.
We're happy to be here to serve the needs of the community, but we're also happy to provide this service for urgent care for
Right,
folks that do
right.
have less urgent complaints and want that timely and
Right.
effective and same quality experience that
Right.
they have at the hospital.
Yeah, and this is the time of year, snake bites. If you got a snake bite, go to the ER.
Yep, that's a
Don't-
great
Don't go to
point.
urgent
That's a great
care.
point.
And, lawnmowers, they run over a foot, and that's another ER visit.
Yeah.
That is definitely not an urgent care visit.
Yeah.
And, you have your seasonal things like
You
that.
definitely do. The respiratory season for us, we started in October, and respiratory season kicked in pretty quickly thereafter. We, at some point, saw 50 visits a day over in urgent care, and respiratory season was in full swing. So we are very, very accustomed to seeing the traditional respiratory illnesses, and we encourage folks that unless they're having severe shortness of breath, we encourage folks to visit our urgent care for that. They do a really nice job of testing for those respiratory illnesses and treating appropriately.
Right, right. And they can be taken care of. And as you said, if it's more severe than the patient thinks, then you can get them over to the
Absolutely.
ER
Yes,
and
ma'am.
get them taken care of
Yeah,
there.
timely
so.
manner, we sure can.
Yeah, I think that's great.
Yes,
So
ma'am.
yeah, it's sometimes it's probably hard to make a decision for the patient, and I guess if you can't decide and you think maybe you need to, then ER is the way to go. But
Yeah, that's a good rule of thumb for sure, for sure.
all right, well, it's time for our next break. So when we come back, I don't know what we're going to talk about. We'll figure out. We're three pretty smart folks. We'll figure out something to talk about. So don't go away. We'll be right back.
It was fantastic. He was different from everybody else I'd ever seen. He's compassionate. He really cares about his patients. I told him, you were my guardian angel. My experience with Nash was A+. So then the surgery I need here on out, give me a blank piece of paper, I'll sign it. I want you to do it.
Learn more at nashsurgery.com.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't rise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Welcome back. This is Here's to Your Good Health. I'm here with Meredith and Daymeyun. Meredith is the nurse manager of the ER. Daymeyun is the manager of the urgent care over at Nash, or UNC Nash. And we've been talking about different services, what they offer, when you should go, which place. And if in doubt, as Meredith just spoke just at the end of the last segment, is if there's a doubt, then just go to the ER and let them figure it out. A lot of people aren't medical, they don't understand all that, and we want to make sure that you're well taken care of and that you are treated appropriately. And even if you went to the urgent care and needed ER, you could get to the ER. I know that we talked about that too. But
if you do have a question, that would be the way to go. So Daymeyun brought up a good point, and that was insurance. So are there any insurance? Probably you can designate if there are any you don't take versus what you do take. I'm sure what you do take is broad.
Yeah.
But, and is there, do most people have insurance coverage for an urgent care on their excuse me, their plans?
Yes, ma'am. Yeah,
Okay.
Yeah. So when the patient does present to the urgent care, usually 9 times out of 10, most of them are already in our system, so we can just re-verify their insurance just to make sure that it's up to date and make sure everything in there is accurate. We also take their card and we scan fax it into the system, and at the bottom of the card, it'll usually tell you how much the copay is for an urgent care visit. So yeah, most patients.
Is
do.
that considered a specialty the way endocrinology is? Or?
Yes. So on your card it'll say like specialty and this, and then it'll say urgent care is that amount. So yeah, they kind of treat it like that. Yes, ma'am. Most insurances do. So we see wide range of, well, we accept wide ranges of insurances.
We
Of
are
course,
enrolled with a number of
Yeah,
payers,
we are.
including Medicaid and Medicare.
Sure,
And
of
so
course.
we're able to manage most commercial payers without any difficulty there.
Yeah, and then I guess the ER visit is more expensive than the urgent care as far as the copay, I would think. I don't know.
Typically, yes, it is. Yeah.
Now, if a patient does not have insurance and they decide to come into the urgent care, if they've never been seen within the UNC system, then there will be a $100 copay. And if they have been seen in the UNC system before, it'll be an $80 copay. And then anything additional will be billed by UNC, and they'll get either a bill or they'll get a statement within their My Chart.
Okay, so when you say the copay, does that cover like the visit with the doctor?
Yes, that gets them
And
in
then,
the
of
door.
course, any testing or
Yes.
anything is all additional?
Yes, ma'am. All of that is additional, and they'll get all of that in a separate bill. And then as far as like an x-ray, if they needed something like that, then they'll get an additional bill from Eastern Radiology.
Gotcha.
Yes, ma'am. Yeah, but
Okay.
that 80 or that 80 for the UNC, who's been seen by UNC facility before, excuse me, or 100 if you have never been seen. Yes,
Okay,
ma'am.
so you can still be seen even if you don't have
Absolutely.
insurance?
We will never turn you away.
Okay.
Never turn you away.
I know you don't in the ER. But I wasn't sure about urgent care
Yeah,
because
yeah, we wanna make
that's
sure.
a new world to me.
Right, yeah. Just want to make sure that all of our patients are well taken
Right.
care of. So yes, ma'am,
Right.
we'll definitely see them.
Okay.
Yes, ma'am.
Okay, awesome. So I can go there with my sniffles, I can go there with a headache, that's probably sinus, or I just have a headache for whatever reason.
Yes,
and,
ma'am. If your itchiness, itching like
yeah,
hives and
that's a
stuff
good
like
one
that.
this time of year,
Allergies. Yeah.
poison
Allergies.
ivy and that kind of thing too, so.
Yeah, so yeah.
You know, a lot of our patients, as I mentioned before, don't have access to primary care for whatever reason. It's difficult sometimes to get connected, and we're able to make those connections. Daymeyun mentioned previously that we make ortho referrals or
Right,
appropriate
right.
specialist referrals. We can also set patients up with a primary care physician as well.
Okay.
Many times they just need that sort of first touch
Sure,
point to make those
sure.
connections, and so we're able to do that also, especially for those folks who report that perhaps they don't have a primary care physician. We've identified an illness that they may need follow-up for. We're actually able to be maybe one of the spokes in that wheel to kind of make those
That's
connections
great.
for them. And it's a goal for us to enhance or improve the access for our patients for primary care as well.
Sure,
Within the Epic system, as our front desk person is checking the patient in, of course you have to link which provider that the patient is being seen today or that day, excuse me,
Right, that's right.
for that urgent care visit. But if you scroll up a little bit more, it'll have a primary care physician. It's like a slot where you can, plug that in. And I've instructed my front desk staff that if they don't have one, ask them, are they looking for one? And then we also give that information over to the provider that they're seeing that day, so they can instruct them on what they'll need to do within, searching for a primary care physician. But yeah, we definitely make sure that information is available to them.
That's really important because a lot of people, like you said, they can go for years and not see a doctor, and boy, then they really got some issues that need
Absolutely.
some treatment, and it's not going to be 1 or 2 times, you know.
Well, and we all know of patients who come in with maybe a laceration, but we diagnose them with hypertension while they're there. Or perhaps they come in with an infection, and we diagnose that they have diabetes while they're there. And to your point, maybe they've never seen a physician before.
Right.
And the reason that they came to us is something that's going to be very temporary, but they're going to need follow-up for that new chronic condition that
Right.
they have.
That's right.
It's really important for us as healthcare stewards to be making those connections for them. So we see that as part of our mission as well, even in the urgent care space.
I think it's great.
Yeah.
It's really, it's all about the patient, you know. Too many times it focused on other things other than the patient and the patient's needs. And sometimes it's a simple need of an advocate that, you know, somebody that can just say, wait a minute, Linda should have this, you know, and I think that's awesome. That's really good. I'm glad that, you know, Nash and UNC is focusing on that. They're seeing those needs and they're concentrating on them. That's great.
I think one of the things that, again, our hospital administration and leaders have recognized is that healthcare outside the 4 walls of the hospital is where our healthcare system needs to focus its energies. Population health is a buzzword many times, or a buzz term, but that's exactly what that means, is what is our role as healthcare providers within the organization to try to meet the needs of patients outside those 4 walls. And we've done a number of things throughout our healthcare system with our community paramedic program. The list goes on and on, our partnerships with OIC with a mobile clinic. But again, what we feel like our role is in the emergency department space and emergency services line is helping to make those connections
Right.
outside the 4
That's
walls.
Right. That's right. That's it right there. That hits the nail on the head, I think. So, so the ER is 24/7, and there's
Absolutely.
always somebody there to take
Always
care
there.
of you.
Yeah.
And urgent care is going to be 9 to 7. It's
June
9.
1st.
June
it's
1st.
8 to
We're
6
8 to
right
6
now.
now.
Yes,
Well,
ma'am.
June 1st is
June
right
1st,
around
just
the
around
corner.
the corner.
It's tomorrow.
Oh, okay. Really? I mean, half of this
May's
year.
gone.
Oh, half of this year is gone. Where did it go?
I don't know.
Out the door.
I don't
Crazy.
know.
It is, isn't it?
Yes, ma'am.
Whew, okay, I thought it was just
They
me.
say the days are long, but the years are short. That's what
And
I've heard. It's
You
the
know
truth.
what? That is
Yeah.
a true statement.
Yeah.
And the older you get,
It seems like that's even more true. Yeah.
that's right. That's right. So anything else you want to highlight or focus? Any upcoming projects that are in the works?
Oh
that-
gosh, in the emergency services area, not that I'm aware of. We are just
Okay.
continuing to refine those processes and practices that we know make us great, and we know that our patients expect. Improving that communication
Right.
with our patients. We're excited about the next year and what that's going to bring for us.
Great. At one point, and there still might be, they had paramedics that would go out like post-hospitalization, I
Yes,
think.
yes.
And that paramedics would go and check on them.
Yeah.
Do they do that for ER and urgent care patients as well?
So
if
right
you
now-
feel they need it? or-
Yeah, right now there is a mechanism where we could refer a patient to our community paramedicine program and they would absolutely make a visit. Our community paramedics program has really grown over the last couple of years, and they're focusing on very specific illness types with congestive heart failure, our dialysis population, et cetera. But we do have, we actually employ paramedics within our emergency department who care for patients at the bedside. Our community paramedicine program, though, I can see it continuing to grow over the next several years. And we identify a subset of patients that may have to use our emergency department frequently, and would love
Yeah,
to see
yeah.
a program like that come, for sure.
Because a lot of times people just don't know.
Yeah.
And you know, if you can educate them and they feel like they've got somebody that cares about them and goes and checks on them. So I think that paramedic program is great. How long has that been going?
The community paramedicine program's been part of NASH for several years, at least 4 years that I know of, and it's just continuing to grow as we see the need growing in our community.
And so do you all hire your own paramedics, or you work in collaboration with like Nash County, Edgecombe County? How does that work?
We hire our own. However, Nash and Edgecombe counties also have community paramedicine programs.
Oh, they do?
So we certainly work in tandem with one another, but the community paramedics for Nash are hired through Nash as hospital employees.
Okay.
Yes.
All right. That's good.
Yeah.
Yep. You have any paramedics over at the urgent care?
We don't have any paramedics at the urgent care, no. So our motto is front desk staff. We have 2 CMAs, a provider, and then 2 X-ray techs as well.
Okay.
Yes, ma'am.
All right. And you got everything over in the ER?
We have a mixture of a number of different skill sets.
Yes,
we
that's
do.
right.
That's right.
Yeah.
All right. Well, anything else we want to highlight?
We just encourage you all, the community, to come out to the urgent care for any needs that you have. We like to think like we have a family type of aspect at the urgent care, so very loving individuals, very caring individuals. We just want to, help the community get better. So please come and see us, and I don't mind hopping in. I say good morning to every patient. I pop into the
I
room
bet
just to
you
make sure
do.
everybody's
I
okay.
bet you do.
great.
Yes, ma'am. So, yeah.
All right. So if I go over there with a skinned knee, I'm going to say, "Where's
Daymeyun?
Mr. Johnson?" I know him personally. I can throw my weight
can
around.
say that.
Please do
can
come
drop
and
his
see
name.
me. Yes, ma'am. I would definitely pop in to see you and help you on back.
All right.
We're going to end our little discussion. Thanks so much for watching, and
Thanks so much for you two coming and highlighting those differences and helping educate our community, because it's all about education in my view. It really is.
So we will see you all next week with more of Here's to Your Good Health. Good night. Have a great night and have a great, safe, long weekend. Good night.
He was different from everybody else I'd ever seen. He's compassionate. He really cares about his patients. I told him, "You were my guardian angel." My experience with Nash was A+. So any surgery I need here on out, give me a blank piece of paper, I'll sign it. I want you to do it.
Learn more at nashsurgery.com.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't arise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.